good night's sleep actually is better understood when you don't get one.
A sleep study is for kids who, from very ages, all the way from 2 months up to 21 years of age, that can't seem to get a good night's sleep, that wake up multiple times throughout the night, can't go to sleep, or are sleepy during the day. So we do sleep studies to find out why that is. So we ask for a 2-week report before their sleep study so they know their sleep habits, when they get up, when they go to sleep, when they go to bed, that type of information. We do send a patient instruction sheet to the families about what to bring with them, where to go once they get here, but main points are the child cannot have any braids in the hair. If they do have braids, they may be taken out just for the electrodes and wires to be placed on the child. Pajamas, we prefer 2-piece pajamas because they do put wires on the legs, so it is preferable to have the 2-piece pajamas instead of the 1-piece pajamas. The day of the sleep study, it's recommended that they bathe the morning of the test to assure the stickers will stick to the child's body, not to use any lotions or hair gels on the skin or the hair, and not to have any food containing caffeine, which means chocolate, teas, colas throughout the course of the day.
So once you arrive into your room with your child, the technician will show you that there's some paperwork to fill out. Once you fill out the paperwork, you will also give any medications to the technician that your child takes during the night so they're aware of that and they can mark it down. And then they'll give you a few minutes to change into your pajamas, and then after a few minutes the technician will come back into the room and explain the procedure to you, show you the wires, and answer any questions you may have before she gets started.
If the child is on any medications, the parent is responsible for administering those medications to them that night.
The child comes in with usually a parent. We have a room for them, and the child and the parent are occupants of the same room in the night. The child is what we call hooked up, which means lots of wires and sensors on the child's body and face. Important thing to remember is nothing hurts.
The first thing that the technician is going to do is they're going to measure, clean, and prep the sites where the electrodes are going to be placed on the child. This gives them the landmarks where they need to place the wires. The first 12 wires that they place on the child are going to be on the top of the head, and these wires tell us the sleeping patterns or brain waves of the child. It tells us when the child's in a deep sleep, a light sleep, or when they're even dreaming. The remaining wires will be placed on the face, the chest, and the legs. There is a stomach and a chest belt that gets placed on the child. This tells us the respiratory effort that their body is giving throughout the night. There are 2 electrodes that are placed on each leg, and that tells us any kind of limb movements or body movements that the child has throughout the study. There's nothing that we put on your child that doesn't have a particular purpose. One of the things that we put on the child, and it's the most important one that we put on, is the airflow sensor and nasal cannula that goes right underneath the nose and above the upper lip. And this may tickle or even agitate some patients, but like I said, it's probably the most important thing because this rules out any kind of breathing disorders that your child may have. Only one parent can stay in the room with the child during the testing, and the parent is required to stay overnight through the entirety of the test. They are not allowed to leave the lab or go anywhere outside of the lab during the testing either. Generally, we try to get at least a minimum of 6 hours of testing and upwards of 8 to 9 hours. The technician will come into the room, turn on the lights and wake you up, and begin to take the wires off the child. And then they will explain to you the process, what to expect after that as far as how long it takes for the results to come back, who you will be hearing the results from, and answer any questions you may have at that time prior to being discharged.
We go over that data page by page. When I say page, I mean in 30-second or 10-second intervals at a time. So we may have 8 or 10 hours worth of data to go over very meticulously. And we have data from the brainwave analysis, we have data from breath analysis, from heart waves, the gas analysis for oxygen and carbon dioxide, leg kick counts, etc. So all of this, including breathing effort at night or lack of it, which would mean apnea, is consolidated on this one computer screen that we look at very closely. It takes several man-hours to consolidate that data, and then someone like me, who's board certified in sleep medicine, would look at that data, interpret that data to see whether it is showing any meaningful findings or not, and then write a report for the ordering physician.
We usually say 5 to 7 business days as far as how long it takes for the results to come back. And the results will come back from the ordering physician, not necessarily our lab. So it's important to know who ordered the test for your child, because that will be the person who will give you the results from the sleep study.
It's like a slumber party, staying over a friend's house, just with a bunch of wires attached to your head.